Hello, it's me Ramesh Mandare. Today in this video I am going to discuss about the prevention and the control measures of the coronavirus infections. As you know that the coronavirus, which was first reported in the Wuhan of China, since then the virus has spread to to 162 countries all over the world, infecting a million of populations. Now the virus has spread more than 162 countries all over the world, leading to the death of around the 6,000 populations all over the world. Now, the infections of COVID-19 virus is, is, is increasing day by day. So it is necessary to take a certain prevention and control measures in order to control the infections rate and the death rate due to the COVID-19 virus infections. So that today I am going to discuss about some important measures in controlling and preventions of the COVID-19 virus infections. The first measures for the prevention and the control of the COVID-19 virus infections, it is the washing of your hands before drinking, eating, and whenever you went to the public area. The first steps is to wash your hands with the soap and water for at least 20 seconds while before drinking, eating, and whenever you go to the public area.
Remember to wash your hands with soap and warm water for 20 seconds before eating or drinking, or whenever you've been out in public.
If you do not have a soap and waters with you, in that case you can use a commercially available alcohol-based sanitizers, such as like the Dettol or the Savlons, whatever you have. You can use the alcohol-based sanitizers in order to disinfect your hands.
Sanitize before and after you use a shared space, whether you're brushing your teeth in the communal bathroom or visiting a computer lab. I know this much cleaning sounds. Sanitize before and after you use
Remember
a
to
shared
wash your
space.
hands with
And another important steps in controlling the prevention of the COVID-19 infections, it is you should not touch your nose, mouth, and eyes with your contaminated hands. So that you should be very careful that you should not touch your eyes, nose, and mouth with your contaminated hands.
Avoid touching your eyes, nose, or mouth without washing your hands first, so you don't infect yourself. If you've come into contact, avoid touching your eyes, nose.
And another important measures, it is a social distancing. Like you have to maintain a social distancing while talking with the friends, or while sitting with the friends in the classrooms or in the cinema halls or in the room. You have to maintain a distance of around the 1.5 to around 2 meters to prevent the COVID-19 virus infections. Why we are maintaining a social distancing of around the 1.5 to around 2 meters means, as you know that the COVID-19 virus, it is spread through the respiratory droplets. The respiratory droplet which is produced during the time of coughing, sneezing, and speaking can travel to a distance of around 1 to around 1.5 meters. So that if you maintain a distance of around the 1.5 to around 2 meters a distance, then the respiratory droplet which is produced by the infected person cannot reach to you. so that you will not, there is a less chances of getting infections. So that we should keep a social distancing while talking with the friends, or while sitting with in a classrooms, or while eating, or in readings.
is through air droplets.
See here, like is shown in the videos,
Or even through talking.
like respiratory droplet is produced during the time of coughing, sneezing, and like
Distance to avoid
then
being in contact with another person. Social
we should keep a distance of around 1.5 to around 2 meters to prevent the COVID-19 virus infections. And another important most measures important steps in controlling and prevention of the COVID-19 virus infections. It is, since the COVID-19 virus, it is transmitted through the respiratory droplet. The portal entry sites, it is a respiratory tracts, so that the people should wear a mask while going to the outside. The people should avoid visiting the crowded place, the crowded areas, such as like the market, the cinema halls, or the like in the restaurants, or the gyms, or the like swimming pools. The people should avoid the visiting of the crowded area. If necessary to visit, they must compulsorily wear a mask. Similarly, the people should avoid the traveling of those areas where the cases of COVID-19 virus, it is very high. Suppose the people should not visit or the travel to area with those area in where the COVID-19 virus infections is very high, like in the Wuhan in the China, like in the Iran, like in a Italy, in the South Korea. During this period, the people should not go to those areas. If they went to those areas, there is a more chances of getting the infections with the COVID-19 virus. So that it is better to avoid the travelings in a high risk area of infections with the COVID-19 virus. And another important measures in controlling and the preventions of the COVID-19 virus, it is to avoid the contacts with the people with which they have developed symptoms of fevers, coughing, and the sneezings. Within 2 weeks, a visit of highly risk zone area of coronavirus infections. Like suppose the person has come to the Wuhan, or they reached to the Korea, or they went to the Italy, and after they have after 2 weeks, they start developing the symptoms of fever, coughing, and sneezing. In such a cases, we should not go close to that persons. Similarly, we should avoid a close contact with the persons who are sick and having a symptoms of fevers, sneezing, and coughing within 2 weeks of contact with the suspected case of COVID-19 virus infections. As is shown in the figure, like people should not travel, should avoid a contact with those persons with they travel to the high risk zone area of COVID-19 virus infections. Or we should avoid a close contact with those persons with they are showing the symptoms of coughing, sneezing. Within 2 weeks, within a 2 weeks interval of the time of close contact with the suspected case or the confirmed case of COVID-19 virus infections.
person could be at risk.
And another important steps in controlling and prevention of the COVID-19 virus infections, it is the suspected case or the confirmed case of COVID-19 virus infections, the suspected patients or the confirmed patients with the COVID-19 virus infection, this will be kept separately in a isolated room having a negative pressures,
CDC defined close contact as being within about 6 feet, 1.8 meters, or within the room or care area of a person with the coronavirus.
And people should not be allowed to go
protective clothing or having direct
in an isolated room without wearing a personal protective clothes or without wearing a mask or the gloves. And another important steps in controlling the prevention of the COVID-19 virus infections, it is cleaning the high top surface area of the doorknobs, tables, kitchen racks, phones, keyboards, and the bathroom fixtures with the different types of disinfectants which are commercially available, such as like the 0.1% hypochlorite solution or the ethyl alcohols or the phenols, whatever the we can clean the top surface of our doors, knobs, tables, kitchen rack, phone, tables, chairs with the different type of disinfectants such as like the 0.1% hypochlorite solution or the ethyl alcohols or the isopropyl alcohols.
Also suggest cleaning high-touch surfaces with a disinfectant every day. Clean your doorknobs, kitchen counters, tables, toilets, phones, keyboards, and bathroom fixtures daily.
And another important measures steps in controlling and prevention of the coronavirus infections, COVID-19 virus infections, it is about to unnecessary contact with the live or the dead animals. We should not touch to the live or the dead animals. If you touch the live or the dead animals, you should immediately wash your hands with the soap and waters. And another steps is we should not eat the undercooked meat and the vegetables. We should avoid eating the undercooked meat and vegetables in order to prevent the COVID-19 virus infections. I think this video is very helpful in prevention and controlling the COVID-19 virus infections. Thank you for the listening these lectures.